this is an event on public sector resource allocation processes. It's been organised by myself and some others under the auspices of the Royal Statistical Society's Data Ethics and Governance section, which is a new section for the RSS. For those who don't know too much about the RSS, because I've spread this to some places where for people who are not normally statisticians or don't regard themselves as statisticians, you don't need to be a statistician, a professional statistician, to join the RSS or be a member or go to its events. The RSS welcomes people who have an interest in stats and data science. That's people like me. I'm not a professional statistician, to be very, very clear. How else could I be a jack of all trades? And this event is about how the public sector allocates resources, so usually funds, to groups of people. So, for example, groups of people or places or institutions. So, for example, the amount of social funding provided for social care to each local authority, the budgets for hospitals, budgets for police forces across the country. And often it gets down to the details of how some of those funds can be allocated, what kinds of services they're meant to be done on. Now, we deliberately advertise this event using the term algorithms. Now, partly that's because that's how lots of people refer to any methodology that uses data to inform a decision nowadays. And if the methodology is actually a model, whether it's some spreadsheets linked together. I think there's one of the spreadsheets that's informing some of the stuff in Treasury at the moment. I think I saw some of 300 spreadsheets linked together to inform some decisions. That must be a fun little exercise, making sure those things work. Or sometimes the methodologist, a 3-line methodology in a process document buried in a filing cabinet somewhere at the end of a corridor. But these things can still conceptually be often referred to as algorithm, regardless of their complexity. And we also partly be called algorithms because there's other algorithms that affect our social care services, hospital services, police, which are often in the public debate about both. So there's algorithms that directly assist decision making in those services. How do I triage somebody in a hospital when they turn up in the emergency ward? How does a social care worker decide which families to investigate under initiatives like the Troubled Families Programme, for example, which is I'm seeing appearing in lots of reports again at the moment. And these two types of algorithms about resource allocation of funds, and algorithms on that decision making that directly affects individuals, they're part of the same system or structure that affects the public services everyone receives. So often these things they can interplay off each other. Really, when it gets down to, is there a hospital bed for me when I turn up? That is affected by both of these types of processes, which use data to help make them make decisions. Not that I've ever needed a hospital bed when I've gone to hospital, because I've been very, very lucky, despite my middle-aged miscreantness over years. So in this event, we've got expert speakers who deal with both of these kind of algorithms. So we have Sheena Asthana from Plymouth University, who's worked on funding formula for many, many years. They're doing some excellent work exploring those and picking them, etc. And Jenny Brennan from the Ada Lovelace Institute, which I don't think everyone's quite aware of, as those of us in data policy world like myself. So the Ada Lovelace Institute is a new institution supported by the Nuffield Foundation, alongside things like the Bioethics Committee, which the Nuffield Foundation's run for a few decades now, I think. They're looking at issues around data ethics in that space and data policy more generally. But Jenny will explain a bit more about the Ada Lovelace. And I was interested in pulling together this event in what we'd learn from bringing together the work ongoing in those two kind of spaces, those two kind of definitions and uses of algorithms, and what they'd have in common. For example, the broader political and policy context that affects some of the design decisions, the use of a wide range of personal and non-personal data, the use of some of the techniques, so statistical techniques play differing roles in those two places, but they're used in both of those places. Some of the challenges we have around transparency and accountability in both of those kind of algorithms might have things in common. And some of the things that might be different, the techniques we use to develop them, the kind of people who develop them. I know I've done a lot of work on algorithms around individual decision making. I don't see many people who would call themselves a statistician, even if we're looking up stats on Wikipedia as we go along. It's not always on Wikipedia, sometimes we use textbooks as well. be clear, in case someone doesn't know, I make bad jokes as I go along. It's one of my nervous tics. Also some of the difference about how we might evaluate these things. How do we consider them in their context? How do we surface them and bring them up for debate and scrutiny, and ethical debate and scrutiny? So we're going to start off with two presentations. So first from Jenny and then from Sheena. In that section. After each presentation, there'll be a space for questions. So feel free to chat in the chat function during the presentations, but don't ask questions out loud. Please keep yourself on mute. We can also things get going. The speakers might respond to things they see in the chat, might not. We'll pick them up at the end, and we'll open up for a few questions after each presentation. And then after that, we'll see what groups we might usefully split into, or even just all of us, depending on how many people stay online because they get too bored of my bad jokes and nervous tics. To discuss some of the common points that emerge in themes. As an output, as this is the Royal Statistical Society's Data Ethics and Governance section. Obviously, particularly interesting questions that surface issues of ethical debate, of governance and scrutiny. But let's see where it goes. You're the attendees. It's about yourselves as much as it's not about me. And the end after the event, I'm going to be drafting up some kind of note on what was discussed, what we learned, what could happen next. If anyone who's on the thing wants to be involved in either writing up that note or in reviewing what I write, just contact me. Just peterkwells@gmail.com. I'm deliberately discoverable because I'm fairly safe, so I can be easily discoverable. I'm not somebody who necessarily needs anonymity in everything I do. So peterkwells@gmail.com, or the details on the RSS site. So easy to discover. Just contact me if you want to get involved in that. And then just a reminder, just before I hand over to Jenny for her presentation, the event is being recorded. You can request edits if you say something that makes yourself or other people uncomfortable. See that it is being recorded. Please be aware of that. Please ask questions at the end of the presentations, or just use the chat box, or keep your mics and cameras off so we don't get too distracted. And finally, I hope the event is interesting, and I hope it's also fun, because we all need things that are interesting and fun in our lives. Thank you very much. I will now go on mute and hand over to Jenny.
Thanks very much, Peter. I'm hoping in a second you will have a lovely slide in front of you. Fantastic. Hoping everyone can see that. Is there a nod or a wave I could get from the odd face I can see on screen? Yes, excellent, wonderful. Thank you very much. It's lovely to be with you here today. I'm Jenny Brennan. I'm a senior researcher at the Ada Lovelace Institute, and I lead our work around algorithm accountability, a lot of which focuses on algorithm accountability in the public sector. So if you're not familiar with Ada, as Peter mentioned, we are an independent research and deliberative body with a mission to make data and AI work for people in society. So in practice, that looks like a lot of different things, ranging from for instance, running a citizen council on the use of biometrics technology and understanding the red lines and public attitudes to those kind of challenges, through to deliberations between the experts or public on issues like vaccine passports at the moment, particularly topical, and COVID-19 technologies, through to more research-led pieces, like, for instance, at the moment, we've been conducting an ethnographic study in the use of predictive analytics in a local authority in the UK, and that informs a lot of the thinking that that you might hear today and onwards. So particularly today, I want to draw in on our work that we've done, particularly on algorithmic decision-making in the public sector. So we've seen growing adoption of use of algorithmic decision-making systems to inform decisions made about individuals for service delivery in the UK. Now, as Peter rightly pointed out, I'm conscious that in a room of statisticians, the phrase algorithmic decision-making system may cause slight itches or uncomfortableness. In practice, we've seen this is the term that tends to hit sufficient audiences for kind of local authorities understanding what we're talking about, through to data engineers, through to maybe, if you'll bear with me, statisticians grumbly being okay with us using that term instead of model. So forgive me that's throughout. And so And we've also obviously seen in 2020 a lot of high-profile turnarounds or challenges in use, right? So from cases like the challenge to the Home Office visa streaming tool, which assigned visa applicants to one of 3 channels, which would affect speed of application review, using nationality as a factor, which was then dubbed a kind of speedy boarding for white people, through to the rejection of the most serious violence programme under consideration by the West Midlands Police Ethics Board, which sought to predict whether people might be likely to commit their first violent offence with a gun or a knife in the next 2 years, but was found to have a significant technical flaw in the definition of the training data set, through to obviously the very well-known off-qual A-level algorithm grading debacle, shall we say. And what we've also seen is that a lot of these systems are less high profile than this, and that a lot of the research into these has been conducted primarily through investigative methods, whether that's through independent investigative journalism or academic work, a lot of Freedom of Information Act requests, and things like this. And so as a result, there's been growing interest and innovation in mechanisms for scrutiny of these, both in the UK and internationally, which I will touch on a little bit later. So I note that I'm highlighting the challenges here of accountability and transparency in this, because I think that fits the theme of today's session. So forgive me if I don't also touch on potential that people see and in these use of these systems. But our focus today is the accountability and transparency challenges. So we've seen a number of challenges of accountability across these systems, and you can see them through some of the cases that I highlighted. One of the key ones being this idea of building trust and consensus in the goals of the algorithm. If you take something like the off-qual A-level algorithm, what you see there is a goal that was actually set in terms of controlling grade inflation and school level accuracy results, maybe hitting a contrast with maybe a public expectation of individual accuracy. And so challenges between kind of the shape of fairness as a whole distribution versus individual decisions and choices. And in particular, what you see with that is without the upfront statement of those kind of goals publicly being available and being made clear, you then get higher tensions. And similarly, that then flows down to individual decisions, communicating how and why individual decisions have been made, which can be made more complex as the models involved are more complex. And we've also seen challenges with independent scrutiny, for instance, in the A-level off-qual situation. The Royal Statistical Society itself offered up support for independent scrutiny there, but that didn't flow through to action. And then challenges around showing evidence of appropriate risk and impact mitigation mechanisms, and setting up systems of redress, which is perhaps more appropriate in individual decision making. But I think it would be an interesting challenge to think about what that might look like in a more systemic resource allocation scenario. And so what we then see is a lot of discussion about transparency, because as I pointed out earlier, a lot of the initial knowledge of a lot of these systems comes through external investigative methods. And so there have been questions about what systems in use that we might not be familiar with, where are they being used? But I also want to upfront and say that transparency does not equal accountability, but it helps. So we can't assume a direct link between visibility and understanding. There's a lot of fair critiques around the burden of the citizen as a free auditor of the state, by saying that it's possible to access information about these systems doesn't necessarily mean that there's a clear and truly meaningful, transparent process through to the end subject of those decisions. And we can see that in practice. So, for instance, the 2013 Macpherson Review called for the publication of lists of business critical models by government departments, which is a really promising move to help in that, though there are some challenges around what exactly counts as business critical model, which I'll touch on a bit later. But we also see that when the follow-up kind of 5-year progress review was conducted, most of those lists hadn't been updated since 2014. So there's challenges in implementation of that transparency. The mechanisms themselves don't necessarily take us the whole way. But having said all that around the limits of transparency in terms of an accountability tool, we're currently limited for getting to more meaningful transparency measures from a systemic lack of visibility. In practice, we don't know what systems are in use, what models are in use, and where. And that's the kind of first area we've been looking at tackling. And so as part of that, two of my colleagues, Jansu Savak and Silvia Monici, have expanded on looking at both existing mechanisms for transparency and then what the potential further mechanisms we could be thinking about are. So in terms of existing mechanisms for transparency, I think a really interesting consideration within the public sector is that just because they're models or algorithms, as many of you will realize, doesn't mean that there's necessarily not a huge application of existing mechanisms in place. In particular, things from data protection and equality impact assessments applied to these systems can be very helpful, through to procurement documentation. As in practice, we see that many of these systems are developed in the private sector and procured by the public sector, through to audit trails and public spending data that you might expect on any kind of service delivery initiative. Now, if you are really interested in getting into the nitty-gritty of this, there is a much longer version of this tiny snippet of a table that I've screenshotted in this slide in a full transparency mechanisms explainer that's available on our site, which really goes and drills down to, of the existing mechanisms, what kind of questions can they allow us to answer about these systems, and then are they already kind of in the public domain? Are they mandatory or enforced? And then what we find from this is that many of those existing mechanisms for transparency gather a lot of the information that we might seek to know, but a lot of them aren't made public, or if they are, they're often voluntary and either not mandatory or if mandatory, not very strictly enforced. But there's also a secondary challenge that we see, which I think has come through even in today's conversation so far, which is the challenge of shared language. In the same way I mentioned this idea of what business critical models are might be open to interpretation, and the fact that we've been debating over whether we say algorithm versus model, you see the same challenges come through, particularly when you get through to, for instance, local government usage, where you could say, for instance, in some of our research, we've seen people might talk about risk scoring systems. For instance, if using a model in children's social care to predict the likelihood that a child might need a social care intervention within a period of time. Some people might describe that as a risk scoring model or a risk scoring algorithm. But often when you work with frontline workers, they don't see a score. They don't see, this child has been assigned, 0.54 likelihood. And so therefore, through not seeing a score, risk scoring model doesn't really flow through to them as something that they're experiencing. And as a result, it can be challenging then to communicate what kind of systems are we talking about, what kind of systems do people have, what kind of systems are they using, if we don't have a shared language about what systems are being applied, what their purposes are, what their methods are, etc. And so that's led us to both some further work and also some exciting further work across the field that's being done in terms of emerging mechanisms for transparency and accountability. In particular, one of the most prominent ones to emerge recently is this idea of a public sector algorithm register. And this, again, has been predominantly focused on individual decisions, but I think naturally translates to considerations of resource allocation as well. So, for instance, the cities of Helsinki, Amsterdam, and Nantes have all explored and trialed models of public sector algorithm register. In fact, the Helsinki and Amsterdam methods being the newest ones, they're available online now. I can drop links in the chat later if people are interested. And they're not yet comprehensive, but they're starting to build up kind of easily navigable, simple language public pages documenting kind of structured facts about what systems are in use and how and why. And with this, we've been exploring this further at the Ada Lovelace Institute, and also exploring maybe what would be a precursor to that work, which is working with Professor Michael Veal on considering what a typology of those systems might look like. What are the sets of questions we might be asking? What are the sets of descriptive factors that might be easy and practicable for frontline workers or procurers of systems to be able to describe the systems in use? And then that hopefully feeds into the potential for then a public document documenting these pieces. There's also been exploration of algorithm impact assessments, which sit slightly separately from existing methods like DPIAs or quality impact assessments, and are really looking at kind of in advance of the deployment of the system and ongoing through its life cycle, what are the potential risks we might see in future and how might they be mitigated? So for instance, in Canada, Canada has brought into law a public sector algorithm impact assessment to be conducted. However, there's still some work to go here, both in terms of what those best look like and how and if they work. We're yet to see cases of the Canadian AIA used in practice and what that looks like. And in fact, this is a piece of work that we're exploring further at Ada with a public body in the UK to look at how that might be able to be implemented either in a strictly public sector scenario or in the kind of the intersection of public-private sector partnerships. There's also work around transparency in the form of explainability. How do we give useful, meaningful explanations to individuals who decisions are made about? And the ICO and Turing's Project Explain has explored this in depth. I think in practice, I've seen more adoption of this in private sector contexts, but there's, I think, growing interest in public sector contexts for using these kind of explanation approaches. And then lastly, the role of regulatory inspection and kind of audit-like processes. Specifically for the use of models, again, something we've seen mainly applied to the private sector, or explored with respect to the private sector. For instance, how might Ofcom audit a social media platform recommender algorithm? But you can maybe see analogies to processes that we might be interested in with respect to the public sector. So to flow that back into today, if that follows, I think I'm really excited about the conversation that Peter's brought and everyone's brought together to really think about this kind of resource allocation problem, particularly because in addition to the connections that Peter highlighted earlier, and the obvious analogous and overlapping processes and challenges we might see, obviously, individual decisions aggregated potentially become resource-informing data. And in practice, that's what we've been seeing, for instance, in local government procurement of these systems, is that one system that may provide individual decision-making will also be a system, or at least a data set, that is brought together to then inform resource allocation decisions. So if, for instance, you were making predictions about an individual child's likelihood of needing a social care intervention, if you collate all of those predictions across the local authority, you might have some sense of what your expected demand on social care provision would be, and use that to inform resource allocation. And in practice, we're seeing that those are often come part and parcel of a similar package. So I think it's going to be increasingly relevant to think about these conversations together and as part of one piece. And so excited to see how the rest of the conversation goes today. And with that, Peter, if I hand back over to you. I realised I also actually dropped in a couple of further reading links, which I can share either in the chat later or maybe Liz can email around folks if they're interested. But thanks very much, and Peter, back to you.
Thank you, Jenny. That was, and I can still be heard, can't I? I'm just checking because yes. I don't trust my computer this morning. As people can see, one of my Twitter can see all of my computers as I came on step. So thank you for that talk. That's a great overview of what's going on. That's really interesting. And if you could drop in those links, I think that'd be great. There's a couple of questions. There's a request for those in the chat, and also if you have links to the examples as well, that would be good because often they help bring it to life. A couple of questions from the chat. So one was around the human rights impact assessments. Is that something that you've been seeing in practice?
Yeah, so I've mainly seen adoption of human rights impact assessments in a private sector context, but they definitely inform, when I mentioned, for instance, we're considering what impact assessment models might be usable in this kind of case study work that we're doing. That very much informs our thinking. I think when we think about algorithm impact assessments, human rights impact assessments, etc., there are a set of dimensions. Actually, there's a great paper I would love to drop in the chat. Relates to this. There's quite a set of unknown questions within this, and I think we're not at the place where one fixed kind of finished model is clearly set and ready to go. And so I'm really excited to see more trials and explorations of using these kind of processes and documenting the kind of changes and practices that they result in. So human rights impact assessments definitely on our plate and on our minds, and excited to see more growth of those kind of processes trialed and used.
Thank you. And if people just want to use the raise hands button to ask questions, or just come off mute if they've got questions and speak up now, that's fine. Otherwise, I'm going to keep stealing other people's questions and comments and make my own. So a question that Tom King put in the, or comment that Tom King put in the chat, which I'd agree with, is this thing about putting the onus on the authority, on the authority that's developing or deploying the algorithm to make it intelligible is quite an important thing. And I suppose it's analogous, it can be analogous as well to how statisticians think about how they make the statistics that are published as official statistics, how they make them understandable. And that's a responsibility that the regulator bears in mind. How are you seeing that play again? How are you seeing that play out in practice? Are you seeing people think about how to do that?
Yes, I think there's actually two interesting challenges to this. One, I think, is there's still a lot of kind of experimental human interaction type research that I think could be developed around particularly public sector explanations and how to make them effective. And I would love to see more of that. But we are seeing attempts to provide better, simpler, more straightforward explanations. But we also see challenges in that often the authority involved, if they are procuring that system from a private sector organization, can sometimes actually have a limited grasp of being able to translate that across well themselves. So I think there is a question around also this. In practice, a lot of uses are at the intersection of private and public sector, and where we need to place the responsibility clearly sits in terms of the authority to ensure that's there, but in terms of delivering that explanation, sometimes the skill set actually sits within the private sector organization that's developing the system, and so that's one of the tensions that we see is having the appropriate. It requires a complex set of skills to do a good job of those kind of explanations.
Okay, that makes sense. And Adafi, you've got your hand up.
Hi, I had a question around the inclusivity. So you had a very good point about transparency not being the same as accountability. I want to check in on inclusivity. You talked about in your initial introduction about the how some of these algorithms were being used to, for example, A-levels, and then they were found to be actually profiling certain groups. Is there any work that's been done in the inclusivity area to ensure that, for example, the facial recognition, the passport office that was released without being able to recognize black faces adequately? What work is being done in areas such as that? Because even if it's transparent, we know that that doesn't mean that it is inclusive.
Absolutely. I'm a big fan of the investigation done on the passport kind of audit piece that surfaced that. I think there's a couple of really interesting, relevant pieces to bring in here. So the Centre for Data Ethics and Innovation's kind of bias review, I think, is an interesting piece in relation to this and has a significant section on kind of the public sector and the role of equalities impact assessments, but also the further work that's needed here. So I think that's an area that's strongly of interest. For us, our algorithm impact assessment work, inclusion is an important part of that. So that for us is really how do we surface those far before we get to the point of any system like that being deployed or being able to be deployed. And that for us is it's a preventative harm that we really need to take action on. So I think that for me is where a lot of the work is, but it's also something that we've been thinking about with respect to public sector registers, etc. What kind of questions can you ask, and what kind of information will they get? For instance, what work has been done to ensure inclusivity and fairness in the system, or to further that. Is the kind of question that maybe isn't currently in models of kind of public sector algorithm registers, but if it were, may be something we would hope would push this conversation further along.
Hi, yeah, thank you. Great event. Hi, everybody. It seems to me that it's really important and correct that when we're talking about algorithm modeling accountability, that we need to differentiate quite correctly between public service, public activities in the commercial sector. Absolutely agreed. In my work in this area, I think we'd all probably agree that we are missing has to be global, has to be cross-sectional, new revisiting of old debates about waiver, etc., how far we want the state to go in a pandemic situation, etc., etc. There's been so much work in the past. We need urgently to revisit this. Also, of course, involving the public, because society changes. This is all deeply political. I mean, I'm busy banging this thing and trying to get people involved. I've been in touch with Ada. We need to do this. How do we do this? And who's doing this? And how can we get started on it? Because it's absolutely central to everything we're saying to get agreement across sections, across globally, about how far we think states should try to go with data. Thank you very much.
Thanks, Nicola. That was, really great point. I think when we think about this work, we think a lot about this question of how are the use of these systems transforming the relationship between the citizen and the state, and then secondly to that, given the growth of the available technology, what would be the positive vision? What do we actually want to see that relationship look like in the context of data and algorithm systems and the progression that we've seen? And that's a whole big set of questions, but there's a lot of exciting people working on this. So yeah, thanks, Nicola.
Hi, everybody. I've been asked to give a primarily lay-based overview of formula funding, and we don't tend to use the term algorithm, we tend to use the term modelling. So algorithm is not a word, but I think we're talking about much the same thing in this context. I've got quite a lot of slides and not a lot of time, so I will whiz through, but if you have any questions, just stick them in the chat. This is an enormous field. I can give you some examples from across the board, but my particular speciality is health. I sit on the independent Advisory Committee for Resource Allocation, or ACRA, which is responsible for guiding or sort of advising on the distribution of well over £100 billion worth of NHS funding every year. We're just finishing off a book actually on formula funding, though that has been slowed down slightly by other things. So let's just move on to the next slide. So here we are talking about, or what I am talking about, is formula funding really for the purposes of allocating resources to areas. or units. So, for example, the new national formula funding for mainstream schools is moving allocations directly to schools and bypassing local authorities entirely. But for the most part, what we're talking about is allocations that go to areas. So these might be CCGs, clinical commissioning groups in the case of the NHS, local authorities, police, force areas, etc. It's important, I don't know how well you can see all of that, but it's important to note that in fact, in terms of the actual single most important category of public expenditure, we're not talking about formula funding, we're talking about individual entitlement. So by far the largest category is social protection. But nevertheless, we're talking about significant amounts of money which are distributed through complex area-based formula for other parts of social expenditure. And these really vary in terms of the extent to which they're transparent, robust, updated regularly. You know, there's a huge variation. So I would say that I think that the NHS funding formula is probably in the best state across all of the sectors, partly because it's got an independent body guiding that, partly because you have a team, an in-house team now that increasingly does a lot of that work. So what used to happen is that, you know, some crazy research grant would go out, you've got to get this done in 6 months or a year, mistakes were made, and you know, you sort of lost power of the process. So actually going in-house has been a very good thing. The Department for Education has recently, again, released a formula. I think this is far less transparent than the NHS formula, but at least it does clearly state objectives, and you know, I have a few problems with it, but it's certainly more transparent than many of the others. Now, a load of other sectors it's really hard to know what's going on. So, for example, in local government, which, remember, social care is subsumed into, we've had enormous turbulence, both in the way in which we approach formula funding. So we've rejected the so-called four-block model, which was a very complicated and perverse type of model, to move to business rate retention. And it's quite hard to understand where needs, because most area formula-based models are based on an idea of distributing resources for needs. It's kind of a little bit hard to understand where relative needs fits into this picture nowadays. There is some redistribution around the business rate retention mix, but it's a little bit confusing. In other cases, we've got hopelessly outdated formula. So the police funding formula, the original research that underpins this, I think, was undertaken in about 2005. And that wasn't released, so it wasn't transparent. There was an attempt to upgrade that formula in 2015, but as I'll come to later, it was very problematic. Social care, as I've said, is another really problematic issue. A new social care formula for adult social care was published. The research was published in 2014, but because of constant deferrals of the fair funding review, none of these things are happening. We have a new methodology for a children's social services formula, which I think again came out in 2019, but we don't know when that's going to be implemented. So you're talking about a really difficult policy context for something, we're talking about quite a lot of money, a very difficult policy context, and this isn't the only problem. So let's move on to the next slide. Okay, so the main approach by which we do formula funding is econometric. What's very interesting, actually, for you statisticians is that I don't think there are that many statisticians involved in this. This is very much economists, you know, following the sort of sway of health economists. So what we really tend to do in the most basic form is do regression modelling of how, so you might put in historic expenditure, historic activity. In the case of the NHS, it's getting a little bit more sophisticated. You might put use, but against diagnostic data, which we can do for hospital services, but not for primary care services. And again, the GP service formula is very old-fashioned. And what you'll do, and I'll raise this, I'm going to use the phrase used by Mervyn Stone, the well-known Mervyn Stone, who was a emeritus professor of statistics at UCL. He used to call this approach the witch's cauldron, where you basically chuck in all your utilisation statistics, you give them a big stir around, say eye of Newton, toe of frog, and out pop your needs variables. And there is something to that. There was a sense of, well, let's look at the needs variables according to what characteristics basically are associated with previous use. And obviously that's quite a difficult assumption, because you have to sort of say, well, there's no unmet need in my system, or there's no unjustified supply. Well, we know that there's a lot of unmet need and unjustified supply. Claims have been made to be able to control for those things, but you can't. You know, for example, in the hospital formula, they put a number of hospital beds, but there's a whole load of other drivers which are going to affect unequal distribution. There's what we call inherent circularity in this model. So areas that do well, or that have had high use in the past, will be read as needing a high level of services. They'll continue to be given a high level of services, leading to a virtuous cycle, and a completely the opposite effect happens for areas that are underusing relative to underlying need, etc. And I should point out that there's been shifts in two important formulae. The one is the hospital services for the NHS, where they are now using diagnosis. When they're analysing hospital episode statistics, they are including diagnosis in that. Now, what they're saying is that because they're using a national data set, they can get rid of those sort of areal differences. I'm not entirely convinced about this, because we know that some areas have been better funded than others. There may be, for example, you'll find that, well, there might be differences in ethnicity, and they will be built into that system. So it's important to know that. Can I have the next slide, please? Yeah, I've mentioned the witch's cauldron idea. And I think this is this idea that there should be some sound theoretical reasoning behind your idea about where needs resources for services ought to be. A wonderful example of this recently was the community hospitals element of the hospital and community services formula. So they actually managed to find some data, and like I said, I've got quite a lot of admiration for the NHS England team that do this. They do question circularity. They are open to criticism, but they did an analysis of morbidity rather than having to use deprivation as a proxy, which is what normally happens. They actually had direct morbidity codes and found a real bath-shaped pattern by age. So very, very young use, very little use across the sort of adults, and then increasingly high use for older age. Now, there was no relationship with deprivation, and a number of people were saying, well, this doesn't make sense. We're expecting things to be related to deprivation. And you sort of say, well, actually, no, because we don't need to use deprivation as a proxy. What we have is direct morbidity codes. This makes complete intuitive sense, because who uses community services? Children, babies really, with health visitors, and people who need ulcer dressings and all the sorts of things, very elderly people who can't get to outpatients or to their GPs. So it did make great sense. And I think one of the things that we can do, Jenny was talking about algorithm impact assessments. I think one of the things that we can do is sense test, and certainly look against other variables to sort of say, well, what's our distribution looking like, rather than does our distribution look right, which is what's tended to happen in the past. Other problems that have affected formulae, again, we're getting slightly better at this, is high levels of intercorrelation. So what you'll have is you'll start sticking in a lot of, you might have an age for adjustment, then you start looking at what additional needs are, and a lot of those additional needs will be kind of highly intercorrelated. In the infamous case of the area-based formula, which is a health formula in 2002, it was a bit like a sausage making machine. So you'd sort of stick age into your weighted capitation, and say, a young deprived area would go down in terms of what its weighted capitation would look like, and then you'd stick all these additional ingredients in, and it just sort of went up and up and up and up. Opposite happening in very elderly areas. So we are waiting in the dark, and I think that's been a real problem. Another issue has been an acceptance of quite remarkably poor fitting models. So we put a lot of faith in these regression, in these econometric models, but often they're really explaining, less than half of the variation that you're seeing, and you're thinking, well, is that good enough? I don't think it is. And often, and I'll give you some examples of this, a real tendency towards statistical obfuscation. A wonderful example from the Home Office, which I'll come to later on. Right, can I have the next slide, please? Okay, so what I thought would be helpful is to sort of say, well, what are the principles? What are the desired principles of formula funding? And I think that this can kind of probably feed into a conversation both about individual level algorithms and area level allocations. So the first, it sounds obvious, but the first is clearly stated objectives, and we don't always have them. In the NHS, we've had a long-standing issue that we are aiming to both promote equity of access according to clinical need, but also there's a drive to reduce unavoidable health inequalities. And if you look at the distribution of need for services for health inequalities and need for clinical services for management and cure, they're completely opposite. They cancel each other out, or they're less so nowadays with sort of shift in the pattern of deprivation. But that was a real problem. We've had this idea of relative needs for social care, for local government, for relative needs tends to be used quite a lot, but for what? We haven't actually really tended to say, well, are we talking about equality of access? Do we talk about capacity to benefit? Do we want equality of outcomes? Are we simply trying to manage this process through providing stability and predictability and efficiency? Are we supporting ministerial priorities? It's very, very unclear what those objectives are, and that becomes incredibly problematic. So clearer objectives are required and very transparent objectives. The second problem is the underlying logic, and this relates to using historical data. I mentioned this issue of circularity. So if you're sort of saying, well, we're after fair funding, we want to fund fairly, but all you're actually doing is reinforcing previous patterns, which I think that Ofqual education algorithm was criticised for doing, that children from particularly independent schools tended to benefit from that adjustment, whereas children from poorer schools didn't. Then is it fair? So there isn't an underlying logic in many cases for using historical data, particularly when that data is a reflection of perhaps decades of unequal funding. It's really, really problematic. Other areas there may be sort of difficulties with the underpinning logic is the area cost adjustment. So what we say, I'm sure you're all aware of the area cost adjustment, but what we say is that because labour costs are higher in London and the South East, we will make a large London weighting for that for our public sector staff, most of whom are on national grades. So in other words, it's really quite, we need to explain this out a little bit more, and I think there's an absolute case for paying additional costs for additional housing or something like that. But this is just a little bit funny. Are the principles, and this might sound a bit dodgy, but are the principles to actually provide incentives for service improvements? Now, again, if you look at something like the police funding formula, there are no obvious incentives because we don't break our formula down into prevention to crisis intervention. We could do the same with regard to social care, that actually if we got in earlier, we could prevent a lot of crises. And maybe if we had a funding stream around that, which was explicitly supporting that, that would be a sufficient policy lever to start shifting you into slightly better practice. Liz, can I have the next slide, please? Another issue, of course, is technical robustness. And I do find this quite amusing because as somebody who does specialise in resource allocation, I am really used when people say, what's your subject area? And I say resource allocation, and their eyes literally glaze over with boredom because people mostly sort of find this a sort of techie subject. And I think also have a lot of faith in the government that they have the technical ability to do the right thing. And because formulae are not usually that transparent and comprehensible, it's only a very few people who seem to be able to actually be able to criticise them. But there has been a real problem with a lack of technical robustness. A great example is this, I shouldn't be so down on this one, but the 2015 proposed reform of police funding was initially criticised for not capturing. It was really very strongly related to theft, which is a very large amount of crimes, but doesn't really use up very much police time. It was criticised for that. And they said, no, we've got really high correlations across a range of indicators, including non-crime activity. Took a little bit of a look at it, and they weren't using rate data, they were using counts data. So effectively, you could have used anything. You could have, rather than their ACORN code, you could have used the numbers of babies born that year, the numbers of sweet shops in your area, and you would have got a very strong correlation. It was absolutely nonsensical. Another very problematic one was the 4-block model, which they have got rid of and replaced with business rate retention. But this was subject to what we called the Wokingham effect, where if you had a very small change in an input, you could have massive redistribution in all sorts of different ways to different local authorities. So we have a real problem of a lack of technical ability here. And that sounds very snooty of me, but in my ways forward, I do have some approaches which I think that would help. Finally, transparency and comprehensibility. I would argue that the NHS is actually the only sector that has been consistently good in this respect. It used to produce exposition books, which you could decode to find out that link between service needs, the kind of calculated elements of the formula, and final allocations. It's less difficult to do, it's less easy to do that now, but it does provide infographics and descriptions of how its model works. I haven't really been able to find any other, and I do go through this a lot, that I don't think there's any other sector which offers that same degree of simplicity and comprehensibility and transparency. And this has led, I think, to a move in government to say, well, everything's too difficult, it's too lacking in transparency. What we want is simplicity. So we'll have 3 variables. And there's a real problem with that, because you usually then lose sensitivity, and there's a difficult balance to be struck there. Right, I'm on to my final section, whizzing through. So could I have the next slide, please? I don't need to, oh, sorry, there's a final point. Resistance to manipulation. You'll be amazed about this, and this isn't a particular characteristic of any particular party. Both of the larger parties that have been in power have used examples where they've sort of gone, oh, if we just adjust that way, then the distribution will somehow work in the favour of our political constituencies. Whether that's by design or by complete, it's a total surprise to them, I couldn't possibly comment. So, I mean, the argument really is that if you don't set the principles right, which was what I've been talking about before, there's a hell of a lot more space to make music with your allocations. Could I have the next slide, please? Okay, so ways forward. I can say this very, very quickly. I've talked about the previous as about the principles. The second, I think, is that we need to try to work out ways of how we can break this link between historic activity and future allocations, because there is a lot of variation and unfairness in the system. And what we tend to be doing is picking that up and reinforcing it, due to problems of circularity. I really do think we have to have ways of responding to the changing nature of service need, invest more upstream in prevention, that actually our resource allocation should be there as a policy lever for best practice, not just to sort of reinforce what went on before, which I think is really, really important. Sorry, the last slide. What governments I feel should do. What I've noticed over time is that there's a real variation between government departments in both kind of institutional memory about this type of thing, and also, quite frankly, statistical expertise. And I really can't help but feel this is such an important area for what the public, if you actually talk about public definitions of fairness, it would appear that equal access for equal need definitions figure quite highly in public understandings of this. So we need to be able to explain to the public what these things are doing, but we also need to make sure that our formulae are technically robust. And I can't help but feel that what we ought to be doing is building on cross-departmental expertise here, that's sort of setting up in-house cross-departmental expertise that can help all of those sectors, because at the moment, different departments are lacking that expertise and making mistakes. We also need to set up clear processes for external oversight and scrutiny. Again, I think the NHS is quite unusual in this respect, in that it has an advisory board. Quite a lot of the other ones have been a little bit murky. I do note that Maloco, or whatever it's called, Housing and Local Development, had set up a number of task groups when they set up the fair funding review, but that sort of all seems to have gone ever so quiet, but for obvious understandable reasons with COVID. I do think that we need to understand that more haste can mean less speed. There tends to be we need a new formula and we need it next year, and hideous mistakes are made. So I think if you had an in-house system which was well skilled up, that might prevent that sort of thing from happening. But these things need sense checking. They need external scrutiny. They need to be, I think, open to questions about, well, what looks right? And I thought the community services formula was a really interesting one in that respect. It made utter theoretical sense when you talked it through. It sort of jarred because people expect allocations for everything to be associated with deprivation. I think it's really important to ensure that your process is ongoing, so you don't just introduce a formula and don't regularly review it. A good example of this will be the education formula, which has recently been introduced. But there's the most profound shift in the patterns of deprivation have been amongst children in poverty. And if we now look at things like the best educational outcomes are in London, the lowest rates of self-harm amongst young people and children, the lowest rates of hospitalisation for under 18 alcohol and substance use are in London. And yet London gets the highest, by far the highest education allocations. They're not quite as high as they used to be. The gap is falling, but London does very well. And I think that some of the we need to be open to the fact that patterns of need may be changing amongst children and be capable of questioning that. Another issue is the fact that we don't work with sufficient granularity. Now, in the case of health, we can easily get things down to an LSOA level. It's difficult. It's more difficult for children's services. That was done, but it's impossible. It had to be done under real, really very tight conditions. Sorry, I've very nearly finished. This is my last slide. But then when we apply those algorithms, they go to quite crude levels. So they'll go to a CCG or something. And the level of the patterns of service need within a particular CCG are huge. They're very, very variable. So I think that we need to start working with greater granularity and checking that our very local levels of service need are being met by service provision and resourcing. We need to manage political expectations. One of the things that always happens is that when you change a formula, you'll have this we used to have this distance from target idea in health. And of course, if you were below your target from the new formula, you complained vociferously about it. But that assumes that the formula is right. It's really, really problematic. There's always going to be winners and losers. I personally am much more in favour of levelling up, but that's expensive. It strikes me as if all children got the same amount of money per capita that children in London have been getting, we might see some real changes in educational outcomes. And finally, I think we need to engender a genuine sense of understanding and ownership, a public understanding. I think people tend to blame their local services when they're not getting the services that they want. They don't understand that their local services are functioning within a contained envelope of cash that is determined centrally, and we need to make that link much better. And that's all I had to say. If you've got any specific questions about specific formulae, I'm very happy to answer them.
Before just open up for the questions, an observation from me.
Mm-hmm.
The observation, the role of politics and politicians seems more visible in funding formula. In the decision making, the role of politics is often where the push towards algorithms, the push towards efficiency and digital transformation, and accepting that kind of innovation. Whereas the funding allocation formula, it seems to be a lot more about the desire to set political priorities around where the funding should go and what kind of outcomes it should support, which I found quite interesting in the two talks. On the clear processes for external oversight and scrutiny recommendation, this is the question. Would you see that as part of the accountability point in the shorthand we often use in the other parts of it? I suppose just picking on that a little bit.
Yes, completely. I think that this is partly I think that if you had a larger body which was well staffed and had a really, really good board attached to it, and we're talking about the distribution of billions, I mean, hundreds of billions of pounds worth. This is quite important. And yet quite a lot of the stuff is, you'd be amazed about some of the decisions that are made. Sometimes, I've known examples of formula when they've been doing the modelling and they're kind of going, oh, that doesn't look right. That correlation is the wrong way around. Oh, we'll just change it. You know what I mean? Or, you talked about the political side, that they don't actually get involved with the distribution. Yes, they do, I'm afraid. What classic example will be the introduction of the Health Inequalities Adjustment, which was at the time 15% of the NHS budget. And ACRA, the advisory body I sit on, basically said, look, we don't have enough information on which to base this adjustment to say whether it should be 15% or what it should be, because there'd been a major review of the formula. And so the then Secretary for State sort of said, well, we'll keep it at 15% because that then keeps overall allocations in line with previous allocations. You know, it was a totally political decision, and this has happened in local government. It happens all over the place. You know, so it is an issue, and I think this is partly why you need this quite strong, independent body to oversee it, with public participation involved in that. Does that answer your question? Sorry.
It absolutely answers it. Thank you. And the echo is gone. Yay. Looking at the hands, so it was first Chris Dankwa and then Cowan Ashton. So Chris.
No, sorry, I didn't put my hand up. Sorry.
Quite okay. In that case, Cowan.
Oh, hi. Yes, thank you. Yeah, I'm actually a lawyer by trade rather than an economist or statistician. And I have historically done quite a lot of work in social care, both individual and policy level and local and central government level. And I'm just very interested about the implications of all of this for social care funding. And obviously there's kind of quite a wide degree of consensus now of around underfunding of social care. And I was just interested to know, it's not really a detailed question about current models and so on, but do you know whether there is any current work or thinking within government or academics looking to change fundamentally and more radically the way that allocation of resources to and social care and then between local authorities is undertaken?
I think the answer is yes. Social care formulae to date have been based on that very residual model of access. So you're under that, is it 13,000 threshold in income? Is it 22,000 in assets? Which means that very few people are eligible for state-funded social care. So that makes your whole algorithm, the whole modelling, really complicated, because you're not just putting in need for services, you're putting in sort of, in a sense, income eligibility. Now, we're now aware that that system is just not fit for purpose, that we've got millions of older people who are either doing without social care or who are being looked after by their families and their relations. And these are people who often aren't particularly wealthy, but may have made modest savings and just simply can't afford to pay for social care. So I think the COVID situation has exacerbated our understanding that we really do not, I mean, you know, in international studies of social care, the UK system really does come out right at the bottom. It's pretty problematic. The way in which I think people are looking is they're looking at systems like Germany and Japan, where you have what's essentially social insurance systems, but they are universal systems. So we have this real distaste in this country, and anybody ever talks about a social insurance system because they think that it's not universal, it's not comprehensive, it's not like our lovely taxation system. These systems are universal, and for the most part, if you suddenly need some healthcare, you know, it's just a different way of doing it. But with regard to social care, I know in Japan they effectively have an additional levy once you hit 40. And that seems to be what's being talked about in this country. Whether or not it gets implemented, I don't know. But I think they're getting to the point. This has been on the cards for 30 years, and it just gets kicked out of range by every single government. But I'm not too sure how much longer we can do this. But what I think we need is a social insurance system, a system where those who can afford it can put into the pot. Those who can't afford it get it free, if you see what I mean. So social insurance systems, you know, tend to balance out these things. You see what I mean? They're as redistributive. It's just the form of collection of money is slightly different. And yeah, move to something like that. So I think there is something on the cards. How long when it happens is another matter. Does that help?
Yeah, no, that's interesting. That's often that kind of thinking tends to be, or what the association with that kind of thinking, I think, is around our needs of social care as we get older, which is true across the general population, because we've got a very core cohort of adults with disabilities who have always had disabilities, who often don't work as a result of that, and so are eligible. So it's a kind of different cohort within the sort of broader social care.
Yeah, and it's also
adult.
There's also children's as well as children's services. Yeah, no, absolutely.
We're thinking about adult services where you're actually kind of thinking about that kind of issue about financial eligibility and the social insurance model doesn't apply so directly. And so I do wonder whether there's any sort of different thinking that, sorry, I should have been more specific about this at the start, around that sort of working age population, where the issue of insuring yourself against the possibility of the need for social care as you get older.
No, I think
really a model that fits.
It doesn't fit
a very different cohort.
No, it doesn't fit at all. I mean, this basically, it's a model to get more cash into the system, but it's not about individual entitlement. I mean, my personal view about both children's social services and people with disabilities in adulthood is that it should be based on individual entitlement. You know, I really do not understand why your area allocation should affect, you know, where you live should affect what you get. It makes no sense to me whatsoever. And I think in this day and age, you know, and actually we're very peculiar in having this very geographical approach to gaining access to services. Most countries don't do this. You would gain access on the basis of individual entitlement. So in a way, I guess what I'm complaining about is the whole system of area-based resource allocation. You know, it doesn't, in some cases, it just doesn't work for me at all. And it's based on this notion that, oh, we're decentralising, but we're not really decentralising. We're giving local areas power. No, you're not.
Just one more comment, sorry, no, because obviously, you know, but I mean, that is very interesting because actually the underlying legal structure, of course, is for individual entitlement on a national eligibility system.
Yeah.
And that's where the tension is. There is this national system, national eligibility, individual entitlement, irrespective of the resources of the local authority, and then area-based resource allocation. And there is a tension and contradiction between the two. Or certainly a tension, it's not entirely a contradiction, but it seems to me that, as I say, not being a statistician or an economist, that somehow needs to shift, and there needs to be a completely different approach to the central resource allocation for that group, given
but
entitlement.
What you'll find is that the amount of money that actually is required to give services to all the people who require services is not there. And this, effectively, what we've got is, I think, a resource allocation system that functions really as a cost containment system. You know, that, well, we've worked out how much money we're willing to spend. All of you have got these allocations, and that's it. You know, so if you did go into a system of individual eligibility, I suspect that your demand would way outweigh your supply, and that is a political question. But I agree with you.
Thank you.
Thank you. That's that
I'm
tension between
Peter.
Silence to me as well, because I'm thinking about that tension between the individual entitlement and local democracy, and where we put our levers, both for funding and for people to agree what they should be getting from the state, from the public sector, who's accountable for that. It's a long-running bugbear of mine around sovereignty. And where we put it in the UK, or which things. Are there any more questions out there? I can't see any in the chat, and I can't see any hands up. So that sounds like no, because everyone is going through the slides again and taking down the notes and clicking on Jenny's links and taking down notes. So what we said when we set up this session was, when we set up this event, was that after the two presentations we'd do a bit of workshopping, because we've got a range of great people and expertise on the call who could debate particular topics. Does anyone on the call have a particular thing that they would want to, which may have come up, which may have come in passing, or maybe not include at all, which they'd like to talk about the workshop in a bit more detail? I will take silence as no one has that. Chris raised their hand again. Let me just check. That was Chris. There was a rogue.
Could you just ignore me, because I'm pretty sure I'm not clicking anything. I won't ask any questions. Just ignore it. Sorry.
That's quite okay. It's computers. They are pesky things. Adafi, you've got your hand up again. Adafi?
So is this just like any question to do with algorithms, or is it? Okay, so can you hear me okay?
I can.
Perfect. So I'm working with the National Lottery Community Fund and Tracy and Ade to look at the harms and hopefully how to reduce those harms and make positive changes when it comes to data technology, including algorithms, and the impact on Black lives. So that's what we're working on right now. You might know that it's Black History Month, although that is an aside. So we're interested, and I'm really interested in resources that highlight positive stories, positive case studies of using algorithms to improve justice, health, around crime reduction, around employment, enterprise, those kind of things. Because I find that, of course, right now that there are the positives are hugely outweighed by all the biases that we find in the system. But I would like to understand who's working on making positive changes and who is doing good work in this area. So I'm kind of open to anyone sharing those stories of algorithmic success when it comes to racial bias and Black communities.
I was hearing about the positive stories. Had a wonderful conversation with someone called Chukwemeka he's based in Plymouth, doing stuff with suicide prevention, actually. And we were both talking about, I don't know, this might be politically incorrect, but the countering the negative victim narrative of BAME people, and the fact that actually there's a lot of positivity out there and there's a lot of great things out there. There's a lot of racism out there. But one of the things I think really requires celebrating is actually the extraordinary educational achievements of particularly children whose first language is not English, who are now outpacing children for whom the first language is English. There's some really good stuff going on, and you sort of wanted positive stories, and I guess that will be about the high levels of educational investment, that actually giving better allocations does seem to make a difference. It could be that the children of first generation immigrants are being pushed very strongly. I mean, I'm a child of first generation immigrants, and, and so was Chukwemeka. And my God, we were talking about the kind of the expectations of law and all the rest of it. But I think there are some examples, and there are other really great examples where there is good trial level evidence of things that work, and things like mentoring schemes, and so I think there is lots and lots of evidence out there about what works. It doesn't necessarily need algorithms. There are different ways of evaluating evidence, you know what I mean? And I don't think I've answered your question, have I? It's just there was such a silence and one felt the need to fill it.
Those are really good examples, though. Thank you. I mean, we're looking at data and technology specifically because we are technologists, the three of us. So that's kind of our lens, and how that we're kind of thinking about how data and technology kind of tie into every part of your lives. But a lot of the organizations that we talk to don't have the capacity right now to take that those situations and apply it to their advocacy efforts. So we're trying to bridge that gap essentially. But what I didn't want to do was just present people with, well, here's all the bad stuff that's happening, right? Here's all the bad stuff that data and technology are doing to you. I also want to highlight some of the really great outcomes that are happening, because I'm not trying to pretend that there isn't problems, but I'm kind of thinking that it'd be nice to also have a hope focus rather than just
I agree.
Here's everything that's wrong. So I mean, those are great examples that I'm keen to add to our we've got a resource library that we're building up of both academic and articles, academic papers and articles to help bridge those gaps. So I'll definitely be looking up those things about resource allocation. I hadn't considered resource allocation at all. So that's been it's been great to hear about it and think about how that those algorithms create an impact and make people more aware of them so that they can get involved in hopefully shaping them in future. So thank you for your comments.
Yeah, no, it's, and just back on the education one, I think it's completely fascinating because we've been I'm currently contributing a chapter to the CMO, Chris Whitty's report, which is on coastal health. And what's been fascinating is seeing how much that coastal fringe of high disease prevalence is happening, which is largely due to reasons of demography and also deprivation. So it's not hugely, but there appears to be some additional contextual effect. But what's really concerning are outcomes for children and young people. So that coastal children do worse, and particularly free school meal children, coastal children do worse, but it's not statistically hugely different. So when you look at things like movement into higher education, it's stunning. There is a stunning difference between coastal and non-coastal children. And as I mentioned, those kind of public health outcomes like self-harm have a very, very distinctive coastal pattern. So I mean, for me, what I would like to see is a levelling up of education. I think if everybody had had the same, the London effect to me is a demonstration of the good things that proper resourcing can do. But not that I'm expecting we'll see that, but I will continue to fight for it.
Thank you. I say, and Nicola, and just as a declaration of interest, I am a coastal child from just outside.
Hi, Nicola here. Turning back the conversation to what we were touching upon about a minute ago, about how we really move positive agendas forwards. We know if you look at the vast amount of excellent guidance discussions about models and algorithms and bias and the problems, we know this. It's been so much great stuff. We should be doing this. So we seem to know what we should be doing, but we're not doing it. And something I've been looking into now, and I'm fascinated, and I'm tending to look at academia and people like myself historically as an ethicist, a trained ethicist, PhD ethicist. There was a time when one was scared to use data points like ethnicity because you were terrified of it being misused or being put into a category that you want to do ethnic cleansing. And there's something in my mind, this is very intuitive what I'm saying rather than knowledge based, that there's something in some of the systems that we're working with where we're kind of walking like on hot bricks around, facing certain facts which, if in the wrong hands, can be used for negative racial causes, but without certain data, we're not moving the agenda forward. I don't think I'm able to make myself clear, but I do think a lot of us, like me, sort of scientific ethicists, we need to really be straight up and say, we need data on some really tough information, very objective. But we need to be aware there's a possibility to have misuse. We need then to control that this difficult data tying up race, colour, upbringing, money. We have to make sure that this doesn't get negatively into the wrong hands for misuse in social media. I'm not sure whether I'm adding anything or being coherent or whether anybody understands what I'm trying to getting at. But there is something in the system that I think we need to improve here of how we academics work.
That's a good point, Nicola. And actually, just before we go to a couple of the questions which are coming in on the chat, so one of the things I know which I've worked on in the past, and actually which Adafi, I know Adafi, various things for those who from various bits and pieces, we move in quite similar circles, has been actually around data around protected characteristics in services has been a particular challenge to collect in the UK. So those of us who care about public sector quality duties and fair and equal outcomes for many of the public services that have been developed and delivered, and some of the new things being developed and delivered, we've struggled to get to persuade people that it is worth taking the risk of collecting data about protected characteristics like ethnicity, like sex and gender, because of that risk of misuse, even though that data might be required to find out is a service meeting on its legal requirements, let alone any ethical obligation it should be put in place. Adafi, you did most of that work. I don't know if that's Are you still seeing people facing that challenge, or are you seeing some movement?
We're still seeing a lot of resistance. So what we found in that project, what triggered it was the reform of Her Majesty's Courts and Tribunals. That was the trigger. The resistance to doing that, the use of fairly dodgy user research techniques to say people didn't care about this. Which people? This is something that has been, this request to record this information has been coming from advocacy groups like Runnymede Trust for years. And there was just this huge resistance to doing it. I think there's almost this ostrich head in the sands like attitude by saying it would make people feel vulnerable, it would make them feel, kind of discriminated against to collect this information, rather than saying, how could we collect this information in a way that doesn't make people feel vulnerable or discriminated against, but still could be useful for us to improve our services. So I think the attitude was, if we don't collect this, then we can't, you can't prove that there's a problem, and that was what we found. We found that it's still, even after that report's come out, there's still a huge resistance to collecting this information, and COVID has actually been a real kind of clarifier in how much of these things are excuses. So we know that, for example, the courts, let's say, for example, it's not just crime, it's justice as well. So let's say you had a hearing for child support, but you didn't have data. You run out of data. You can't connect to the court's very archaic custom system that they're using to hold cases easily. So you end up having poorer outcomes. And we know this disproportionately affects Black people who are poorer, the people who live in areas where there's a digital divide. But still, there's that resistance. However, there's a new Lord's Justice come in, so hopefully that's something that we can see some changes. The future that we are hoping for is that every service, every digital service, every analog service in UK government and private sector, in any service that's really affecting the public, collects protected characteristics and information as an optional thing, collects them in a way that makes people feel safe, and collects them in a way that's disconnected from the service itself, so as not to connect the outcomes that people are, connect the individuals rather to the characteristics. I could waffle on about this for ages, so I'll stop there.
Thanks, Alafi. And if we can drop it, I can't put things in chat, otherwise I'll drop a link into of course, it's very useful work, which I keep pushing into places. So there's a conversation in the chat just around starting by Tom, who's part of the Secretariat for the Data Ethics and Governance section, and is refusing to join some of the other bits of the teams because it will crash his computer like it crashed mine. Of what should the RSS be doing as a policy project? One of the suggestions there was around exploring what a kind of cross-departmental advisory group around funding formula or some kind of broader definition of algorithms would be useful. In case anyone wants to discuss that outside of the chat and verbally. If not, we're starting to run out of steam, so I may give people lots of their day back, which is always nice to get some good day.
Hi. I think that would be a wonderful thing for the Royal Statistical Society to look at, partly because of this dominance of, I'm sorry, I haven't got it in for health economists. My son is studying economy, but there has been a domination, I think, of health economists and econometric modelling against alternative statistical approaches. And certainly I think that you need to keep on pushing doors in that respect, because all of the statisticians I've talked to have understood the limitations really quickly of econometric modelling, whereas I don't think that the econometric people understand what's available statistically. So what you need in particular, I mean, Mervyn was quite good at this because Mervyn he had a really I don't know if you've ever met Mervyn, but he had the most flowery term of phrase and could certainly make things sound quite funny. But quite a lot of the statistical work needs to be translated into a lay language so that people can understand why these problems of circularity or whatever, or intercorrelation, etc., are happening. And some alternative statistical models sort of put forward in discursive ways. So one of the problems has been is that they've gone and discovered in the last 4 years, they've discovered principal components analysis, which they seem to be using in a fairly similar way to the way in which they did their regression analysis. And I'm not sure it's always, I'm not a statistician, but I'm not sure it's always completely appropriate. So I think that it would be so good to get around a table, a cross-departmental table, with big input from health, who know what they're doing, from NHS England, and just to really thrash this out and sort of say, look, this could be cost effective, you can get best practice, this is a fantastic thing to do, and we the RSS can support you in it. How about that?
Yeah, go girl. Love you.
So that's what I would suggest. But I'm not a member of the RSS.
Why not? We need you.
I'm not a statistician.
Well, neither am I.
Well, I'm happy to join.
And looking at the chat one, we'll also need to look into that, an existing interdepartmental working group on modelling and QA, which develops the Aqua book.
Right,
so we can start maybe that's one of the things, Tom, that the RSS could usually just on digging up some of these things. Because often, and this is a thing I find across the board, on these things, there's so much stuff going on. There's often lots of conversations which are very related, but don't realise they're happening in slightly different places and have not yet met each other. Also in the chat, for anyone who missed it, Tamandra has mentioned an article in the latest issue of Significance, which all RSS members do get a copy of. Mine arrived just a couple of days ago, which touched on race and data. I think that's the interview with Trevor Phillips on some of the work as well that he and the organisations he's part of have been doing. So it's a very interesting interview. I was reading last night in between various things. Great. So I think that was very useful and interesting. Unless anyone has got any other points they want to raise, I think we'll start to wrap up and also switch confound around our planning review. I'm taking notes of. Unless someone else has points they want to raise, I will start to close. We will close the session down. I'm going to do a quick write-up of the event.
I'm sorry. I just have one quick question, if that's okay.
Yeah.
Hi, thank you so much. This has been really interesting. I'm kind of a newcomer to this field, and I work, among other things, in modeling group behaviors. And so I really appreciated the discussion on how individual modeling kind of turns into group modeling. And I'm wondering if, and also how one of the principles of algorithmic decision making is public education. And I'm wondering if there's any work on sort of the meta modeling of that. So if anyone's familiar with kind of modeling how the public opinion around an issue, and I think this is really, really relevant, especially with racial issues, how the public opinion can be formed and discussed, and especially over time as we're seeing a huge shift in public discourse, and if there's any sort of meta work on that and how a particular algorithmic decision will be perceived.
Thank you, Caroline. Does anyone have any knowledge around that? Nicola?
Yep. I mean, I'm not sure that I'm 100% following what you're saying, but when you were talking, I had a memory. I gave a talk some time ago about the use of big data, social media, and nudging and algorithms, and they are kind of interconnected. That in the data innovation era, as I like to rather perhaps pretentiously put it, you know, we've got these huge data sets. We now have the computing ability. We have the methodological knowledge to start making correlations, at least, and to start making predictions in the future. And an issue which we've got to be aware of is that we've got to be careful that we don't go into the nudging area, which is ethically questionable. I'm not sure that I'm being that coherent today, but I think, yeah, I think it's something, it's sort of a side issue, isn't it? We've got to be careful that we're not forging ahead and presupposing what the values of society are and using big data to nudge them. It's going to get into social engineering dangers. And it's something I raised earlier on in the chat. I think you're absolutely correct. We all know that we need to take the public with us, particularly when we're talking about public health data, where the state is assumed to have a huge amount of rights to use data without any kind of consent models, which is absolutely correct. But there's still, I think I agree, an element when in a pandemic, I am also concerned that are we taking the public really with us? We're making a lot of assumptions that they're waiving certain rights. And there is work being needed here. And there have been some things on some data sets which I thought, okay, it's public health ethics, it's public health government. But I still don't think it's good that we start nudging the public into one set of assumptions about what we should be doing for the public good without the individuals being involved. I said I'm not sure how much this is making sense. Does that help in any way?
Yeah, absolutely. I'm interested now. Well, thank you very much, and also thank you to Tom in the chat. I'm interested then how, and perhaps it's a wider discussion. I'm happy to take this off, but nudging versus education, right? Because all facts are just the set of facts that you choose to present. And so even when you're presenting people with facts, you know, it kind of feels to me like education necessarily carries a lens of social engineering. And I'd be interested to hear how the RSS or how other people are thinking about or balancing those.
I love this conversation. I mean, for me, I think it's all about. I think it's I find it difficult to argue, although I think it's intriguing what you're saying. It's all about objectivity of methodology and putting forward pros and cons, which allow people to make their own judgment. But I agree with you, and I think your question is fascinating. And again, RSS, we should be looking at this. And thank you very much. And everybody's got to be joining us.
Can I just make some suggestions here? I don't know if they're relevant, but I've just led this series of workshops with local health trusts, etc., because there's the health infrastructure plan is involving hospital bills and stuff like that. And we basically did a paper saying, look, it's not just about the hospital of 2025, it's about the hospital of 2050, and that means the healthcare system and how we receive health and things like that. And most futuristic accounts will suggest that I'm intrigued from the point of view of both nudging and surveillance, that most of us will be receiving our healthcare at home. So we'll only go into hospital when it's really complex care or when it's trauma, or otherwise for sort of simple procedures, we'll go into ambulatory places. But much of it will be done at home with real-time monitoring through wearables and even nanorobots whizzing around our heads to then give that real-time stuff back to our care coordinators who can do personalized drugs through 3D printing or personalized, interventions and stuff like that. And they'll be monitoring your smart home, and and I'm perfectly happy with that. But that is one vision of the health system of the future, and it's quite interesting because it doesn't really match with the language that you've just been using about. Should we be nudging? I mean, we're not just talking about nudging, we're talking about putting things into people's heads. Sorry, I'm sounding like an anti-vaxxer. I'm not. I'm very happy to have nanorobots in my head. But you know what I mean? There's a future out there which is so digitally and technologically different to what we've got at the moment that I kind of wonder if consultation can do it. It's so wild.
I mean, I agree. I think all we can do is our best, but I think we have to consult. I mean, you're absolutely true. I mean, I do a lot of work on the anti-vaxxers. I have for the RSM, I'm very involved as well. And I think I have a very improved understanding, I think, because of COVID, about how we should, as a people, we're all experts on this call in some way, how we have to interact with the general public in areas where people are scared. People are scared, and how we learn to better respect people's concerns and But I agree with you. We've got to take people forward. And if I can expand this discussion very slightly, one of my many obsessions at the moment is to break out of just looking at the public sector and really start a debate about, when we're talking about public health data, about the commercial pharmaceutical sector, who I adore and I work with them as a consultant, about pushing the agenda along about the public data in a pandemic as a public good, and saying, hey, it's not only is this public health data on a population level, people, the commercial companies who are using that to help develop their products, there's some kind of benefit sharing that's got to be going along. And for me, this needs to be part of this whole discussion with society about how we're using the data for algorithms and the risks and the good things. And it's got to start involving industry more. I'm not against industry, but I think we've got to get this debate and discussion up and running.
My experience is that industry often has better access to our data than we do, because as an academic, it's absolutely impossible to get hold of data, and it's driving me around the bend because, I mean, some of the things we in my institute, we specialise in digital. And some of the interventions that we could be doing, for example, with quite and resilience building amongst children in coastal areas, we could be collecting baseline data through their own phones and actually implementing an app that at the same time is a resilience building, but also data collection app. And I suspect that the ethical problems of going through that will be really, really difficult. And that's frustrating. It's really frustrating.
To get back to something I mentioned in the track, I think I think it's not the ethical questions, it's the lack of agreement about when we have to waive consent for the public good. And I think you're right. There are some people who I think hide behind this pseudo fear. Oh my God, it's data protection and ethics. And it's often not, but it's something it's very convenient to hide behind it. So what we urgently need is to get a new set of guidance, public health emergencies, about sharing data. So we know, community agreement on some level, we know what we can do. And I think most people would say, please use the data,
Yeah, no, I absolutely agree. And I'm honestly not too sure that GDLPs helped here. And I mean, I had a student yesterday whose parents have been getting through, and then suddenly I've been having nice chats with them, and suddenly next thing I know, apparently we've got some private something policy, and I shouldn't be talking directly to the parent. And it's kind of, you what? I'm sorry.
Yeah, but actually, often, and I think we've got some lawyers involved, because I've done a lot of work on GDPR. Often it's a misuse, and it's not true. People hide behind it. And if you look very carefully, also at the pandemic legislation in the UK and worldwide, and also internationally, we have a global health pandemic, okay? And it's well assessed, and all the laws say it is an exceptional situation. And it's really important that we're able to loosen up on some things for the public good and for individual good. But we need to look at this and codify so that the next pandemic, we are not stopped in doing important work because, GDPR, which is not relevant in a pandemic. And people still insist on using consent models for individual medicine, which are irrelevant in a pandemic. We need to look at this, because otherwise we are stopping great work.
I think just bridging a couple of those things, because absolutely, in GDPR and in most data protection regulations, there's exceptions for public health emergencies. Say in a public health emergency, that's a reasonable basis to use data because of what is clearly at risk. But also Sheena's point about the future of health and home health. So I think there's a tension that's going to emerge more going forwards, is what services we continue to offer to people, and then what choices that allows them. Will we still offer face-to-face healthcare for those who prefer it? Will that be as reasonably available, or will there be fewer health centres, to give an example? One of the earlier sectors that's exploring that, slightly deliberately, slightly accidentally, is finance, of all cases, with the removal of cash from the system, removal of cash machines, removal of access to cash. The reduction in the number of shops that accept cash during a pandemic has been fascinating and a topic of debate. I know I was looking at there's a review around this done by Nicolosini and various groups a year or two ago around access to cash, unpicking the reasons why people preferred at that particular point in their lives, which can change, preferred to use cash, whether it be for privacy reasons, because they thought the banks or somebody else might be spying on them, or because of just they prefer the feeling of control that cash gave them. And there's some really interesting subtle points that I think about how these digital systems emerge, how fast we move to adopt them as society, and whether we continue to absorb the cost of allowing people to use more legacy methods, I suppose. I think those are some very fascinating ethical questions we'll all face over the next few years. Political and ethical questions we'll all face over the next few years. And I'm looking at a lot at the moment because I'm doing a report on digital inclusion as well, which is why I disappeared for most of the last month to get my head back around digital inclusion. I'll just for that, just dropping a few things off. The services like committee looking at this now. Yes, cool. Any more debate? I don't want to dominate or close it too early. No, cool. So I'll write up some notes, write up some of the things we've going. I'm on Peter. I can't leave a comment in the chat for some reason because Microsoft Teams, possibly because I've joined as an external, but yes, I don't know. I am on peterkwells@gmail.com. Anyone's got comments, questions, or wants to review a write-up, contributor, etc. Thank you very much to our two marvellous speakers, Jenny and Sheena. If you are off mute, then give them a round of applause. Those were fascinating talks, and thank you to all the attendees for the interesting questions and debate. This was the RSS Data Ethics and Governance section. During the RSS, you get access to significance and lots of other things if you can afford it. Thank you all for your time. I hope you all have a marvellous rest of your day. Thank you.